Allegiance. If I could have one of our parents, Mr. Tremaine, come on up here if you wouldn't mind just joining us at the mic and lead us in the pledge. We appreciate you as a critical partner.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Thank you so much. All right, since we have established a quorum, and I hope not to give anyone's put anyone's business out there too much, but if you could just send up a prayer for the Little family as they hopefully welcome a beautiful baby into Nashville's family of beautiful babies. But we still have a quorum. We will move on to public participation, one of the most exciting parts of our meetings, where we get to hear from community members and understand what their needs and requests are. You will have 3 minutes at the podium. We are still preparing through COVID measures to have you walk up. If you're not seated, if you're walking into the room, please walk into the room to the mic and then exit out the side door. If you are seated, feel free to just return to your seat once you've finished. With that, we will begin. You'll hear a bell at the end of your 3 minutes. Your 3-minute timer is in the front, to the side of you. We will begin with Natalie Morosi. Please feel free to begin.
All right. Hi, good afternoon. My name is Natalie Morosi. My address is 2529 Fairfax Avenue. I'm a Davidson County resident, parent, and educator. Thank you for your leadership of our district during this challenging year, especially during this period of reopening. I'm really excited today to speak on behalf of a new charter application submitted by the founding team of Aventura Community School. I began my career in education in MNPS in 2008, and I worked for 9 years at Glendale Elementary, a very successful bilingual school that has a long wait list each year. For more than a decade, I've had countless conversations with parents, educators, and community members about the potential for an additional bilingual option in our district, specifically an intentionally located dual language school that would enroll a diverse populations of native English and Spanish speaking families. Whew. More nervous than I expected.
All right.
After a few years abroad in Madrid, where I learned more about international best practices in education, over the past year I've been working in earnest with an amazing team to develop the model for Aventura Community School. We have met with over 200 stakeholders, including parents, teachers, and leaders of community organizations, to learn more about what our community would like to see in a diverse dual language school and to establish partnerships that will be mutually beneficial for our school and our community. Our charter application includes letters of support from organizations like the Tennessee Immigrant and Refugee Rights Coalition and the Hispanic Family Foundation, who have consistently expressed their excitement for Aventura as a potential resource and a welcoming and empowering school option for immigrant families in our community. Families of diverse backgrounds have shared enthusiasm for Aventura's diverse, dual language, project-based learning approach. As a long-serving MNPS educator, I'm committed to our future collaboration with the district, and though we do not plan to grow beyond a single site, we see great potential for sharing best practices. Aventura's model is well aligned with many of the current priorities in MNPS. Most notably, our dual language models focus on literacy, which we expand to include both English and Spanish. In addition, we plan to be the first local elementary school to offer Valor's amazing Compass social and emotional program for both students and faculty. Finally, our founding leadership team is made up of outstanding educators who are also Nashville parents, which demonstrates our deep commitment to developing Aventura as an excellent educational option for families and a rewarding, sustainable professional option for our future staff. It would be my pleasure to share any additional information or answer any questions you may have. Thank you so much for your time.
Thank you. Next, we'll have Ms. Lagra Newman.
Hello, my name is Lagra Newman. I'm the founder and head of school of Purpose Preparatory Academy, a charter elementary school in the Pearl Cone cluster. We opened in 2013 and currently serve about 400 children in kindergarten through 4th grade. I am here because this January, through the MNPS Reimagine Ed plan, it was announced that the Pearl Cone cluster elementary schools would be adding 5th grade. Upon this announcement, Purpose Prep families immediately began reaching out. Many thought that if the cluster was moving in that direction, then surely Purpose Prep would be included in that plan. However, we soon learned that charter schools had not been considered in that plan and that the amendment process to add a grade level would have needed to take place in October, months prior to this announcement. Had we known in October that this plan would be enacted, we certainly would have applied through that process. However, we found out in January, and there wasn't an established process in place for our families. I want to take a moment to explain why adding 5th grade, especially given that the surrounding schools in our cluster have added, is critical to our students and important to our families. Firstly, this decision impacts our families because now many of them are zoned to an elementary school for 5th grade. This would mean leaving 4th grade at Purpose Prep, attending 5th grade at another elementary school in their zone, and then going to middle school thereafter. 3 schools in 3 years. The lack of an option to stay at Purpose Prep for 5th grade would certainly have a detrimental effect on their school experience. Further, we know that the continuity of academic and social progress is critical. They are making great progress at Purpose Prep and feel especially supported during this pandemic. By having 5th grade, we will be able to make the preparations in support of their middle school transition and ensure continued progress. This would certainly benefit our scholars, which is the reason why this decision was made in the first place, to ensure that elementary students had an additional year to academically and socially prepare for middle school. Thirdly, our families made the decision to attend Purpose Prep. By forcing them to go to their zoned elementary school for 1 year, negates the choice options provided for them by the district and further reassigns them to the same school that they opted out of for kindergarten through 4th grade. To support the 95% of our families who, when surveyed, requested to stay at Purpose Prep for 5th grade, that's about 55 children and families, if provided this option, we ask that a motion be made to allow the charter schools office to submit an emergency amendment that can be voted on by the MNPS board at a subsequent meeting. As an elementary charter school within MNPS, we are committed to providing our scholars and families with an excellent education throughout the total grade configuration, which in our cluster is now through 5th grade. We have the space, capacity, and desire to ensure that they continue to be successful in that transition. And like the district schools, we want to be granted the opportunity of educating our scholars through the 5th grade to maximize this experience. Thank you so much for your time.
And thank you. Next, Dominique Townsend.
Good afternoon. Dear school board members, thank you for the opportunity to speak today. I am Dominique Townsend, a proud parent of 4 children, 2 of whom are currently enrolled at Purpose Prep Academy. MNPS recently announced that the Pearl Cone cluster is adding a 5th grade to elementary. I am here to speak in support of Purpose Prep expanding its current enrollment to include the 5th grade. I have been a Purpose Prep parent for 6.5 years and serve as a Purpose Prep board member and have been for over 2 years. Purpose Prep has continually gone above and beyond in providing a superb educational experience and has continued to excel even in the midst of a global pandemic. Their teachers, staff, and leadership have been dedicated in engaging with my children and making them feel valued. They have been provided with the proper technology and hotspots to ensure that they were successful. This was also an essential need for our family to best manage our oldest 3, whom are in virtual schooling. The commitment Purpose Prep has and their dedication, day in and day out, touches my heart as the goal of my husband and I, both MNPS grads, prioritize education as a value in our household. With being awarded twice as a Tennessee Reward School for Academic Achievement in North Nashville, further supports my desire and full confidence in seeking your granting for the expansion of a 5th grade for the Purpose Prep Academy. I know Purpose Prep will maintain high standards in implementation, the full execution of targeted measures of success, and sustainability in delivered excellence. Having the opportunity to see firsthand the dedication Purpose Prep has as a member of the academic committee, as a board member, further shows me that as parents, our scholars are seen and heard at Purpose Prep. I want you to know, as a North Nashville resident, that I support Purpose Prep, expanding to serve the 5th grade. On behalf of my children, Price and Brinley Townsend, I ask that you please grant Purpose Prep an emergency amendment authorizing the addition of the 5th grade. This will also further align Purpose Prep's grade levels with neighboring schools. Thank you and have a blessed day.
Thank you. Adrian Harris. Trudy Campbell.
my son over there. Good evening. My name is Trudy Campbell, and I reside at 304 Woodland Court in Nashville, Tennessee, Davidson County. Metro Nashville Public Schools has decided to expand elementary schools to the 5th grade, impacting the Pearl Cone Cluster District schools. As a parent, I want the same option available at Purpose Prep Academy to continue the academic progress and social development. Serving 5th grade students is critically important to my child's success and other scholars as well. I value the work at Purpose Prep Academy for the educational foundation they offer. Purpose Prep Academy is where my boys learn to read, calculate mathematics, write comprehensively, gain knowledge in science and social studies, and more. I value and appreciate how they teach scholars positive reinforcements of learning. I'm appreciative to how they have been able to pivot successfully, modify and maneuver during our pandemic to continually offer the high standards in academics, where my child has not missed any expansion of his learning. I am a proud parent of 2 boys, one currently attending Purpose Prep Academy and the other a graduate of Purpose Prep Academy, who is currently attending Head Middle Magnet, and we recently accepted a seat at Martin Luther King. I owe all of this success from the foundation acquired at Purpose Prep Academy. In closing, I want you to know that I support Purpose Prep Academy expanding to serve the 5th grade. And on behalf of my child, I earnestly petition that you please grant Purpose Prep Academy an emergency amendment authorizing the addition of 5th grade, a measure in line with Purpose Prep's neighboring schools. Thank you so much for this time.
Thank you. Jeremy Williams.
Good evening, my name is Jeremy Williams, and I'm here to address the 5th grade expansion of Purpose Preparatory Academy. And as a former student of Purpose Prep Academy, I can say that they've done a wonderful job of raising up many kids and bringing them up from their academic level and being back-to-back reward schools and constantly achieving high mastery in literature and mathematics, which brings them to a high-level charter school. An expansion to 5th grade would help kids coming out of Purpose Prep develop their strategic minds, and as a former Purpose Prep student, I can testify that Purpose Prep has set me on the right trajectory to be a recurring Dean's List student in the 5th and 6th grade and charter many former and present scholars to exclusive schools. I also emphasize that Purpose Prep has also chartered many special needs kids and is also taking care of many special needs kids that 5th grade will give them more time to develop their minds and be ready for the real world. Thank you for your time.
And thank you. Next, we'll have Sonia Thomas. Love to see young people up here.
Hello, my name is Andrew Becker. I am a Maplewood math teacher. Home of the Mighty Panthers. I'd like to compliment our principals, support staff, and everyone for what seems to be a very successful reopening. Excuse me. Many teachers, myself included, when the vaccine became available in other counties, you saw in the news, we drove out there and, got them as soon as we can as a way of keeping ourselves, our community safe. I personally drove all the way out to West Tennessee, McNairy County. Even leaving home at 4 a.m., I even brought my equipment and I taught my pre-calculus lesson from the McNairy County Health Department parking lot right before they opened. Now, many of us who also got the vaccine had, mild symptoms a few days later. And, sorry, this mask. It would be a huge, thing that you might be able to do for us to think of a way to allow us to have those refunded if, coming from the vaccine. Certainly, it's not a big deal for, if we need to use 3 sick days to keep our families and community safe, but we're also, keeping setting the example. And that seems like that'd be a good thing to do for us. And thank you.
Thank you.
I know that we don't usually respond, but can we?
No, we don't.
Okay.
But now, after we follow consent, you're welcome to before Dr. Battle starts her reports. All right, thank you for that, Mr. Williams. All right, Sonia Thomas.
Hello, my name is Sonia Thomas, and I am the Executive Director for Nashville Propel. Nashville Propel represents parents and grandparents from our most struggling communities who have students who are zoned or attend our lowest performing schools. And like many times before, I'm here to represent those families and to defend the ability for parents like me to make the best decisions possible on behalf of their children, their education, and their futures. I'm here to urge you to support Purpose Prep's efforts to expand their school to 5th graders who will otherwise be forced to attend the same elementary schools their parents opted them out of from the beginning. Because frankly, Purpose Prep and the students learning within have been backed into a corner. The announcement that elementary schools would incorporate 5th grade came at a time that prevents Purpose Prep from presenting its own amendment to the board. And now, if the school is going to do the same thing all of the other elementary schools are doing, keep their students for the 5th grade, we need the charter office to present the amendment on Purpose Prep's behalf. I agree with the decision to move 5th grade from middle school to elementary school. I believe that this will benefit the social emotional growth of our children, but only if it's done right. Only if it's done in a way that affirms the parents' ability to choose what's best for their students. And since they were not aware of the upcoming changes until the deadline, we now need your help to do this. While Purpose Prep can't add a grade level under an emergency amendment, there is nothing that prevents the district from doing so with a board vote. So we need your help in defending our children's education, their ability to stay in the place in which they succeed, they feel comfortable, and they learn. Our children have fought so long to get where they are today, high-performing scholars, ready to grow. But the district is now telling those children their hard work has been wasted, and instead of going to Purpose Prep's 5th grade, they will certainly lose that momentum. What would you do for your own children? We, the parents and grandparents and caregivers, are here to stand up and save our children by protecting and fighting for 5th grade at Purpose Prep. It's not fair to suddenly force these students into the classrooms their families did not elect them to be in the first place. The very schools that parents opted out, they would have to go back to those schools. How fair is that? How is that right? It's not. The only reason to stand in the way of Purpose Prep's adoption of 5th grade is to increase the district's enrollment and therefore its funding. But we will not allow our children to be used as pawns, which is why I am here to fight for the best interests, to be at the center of every decision our local leadership, the school board, makes. So I urge you, defend Purpose Prep's right to keep their students for 5th grade. It is the right thing to do for the students. It's the right thing to do for the parents who must be empowered to make the choice they see fit for their
Thank you
children.
so much.
Thank you.
All right, Andrew Becker. He did, all right. I called him Williams, goodness gracious, okay. That was the baby. All right, we'll move on. That concludes our public participation. Mrs. Tyler, go right ahead, and then we'll jump into consent.
Yes, I just wanted to circle back around to what the Maplewood teacher was talking about. I know that Dr. Battle, you and I had an exchange last board meeting about our teachers not being charged sick days when they go to get their vaccine. And you specifically said that your guidance from the from the central office directly to the schools was that the principals should be working with their support staff so that the teachers do not have to take that sick day. And it sounds like that's not what's happening. What can we do to make sure that our principals understand that?
Yeah, so I think there was a couple of different things that were mentioned there, and I think we need to be clear about what the question was, so it's kind of hard to respond without having some more details. It sounded like that this was prior to the that he might have gone to get his vaccine prior to our rollout of the vaccine, and likely didn't have a prior conversation with his school staff. But Mason is going to, Dr. Bellum is going to speak to the communications that have gone to staff for consistency, and then Dr. Barnes will speak to the process we have for our COVID response that we started with in the fall.
And then just before, hold on, I'm sorry, I'll let you talk in just a second. It sounded like he did not take a sick day on that day because he said he taught his students in the parking lot, so he was still working. So to me, it sounded like, knowing that he was going to have to go back for his second shot, that's when he's been told he has to take that sick day. And I know that there are several teachers who went out of county that now will have to return out of county to get their second shot. And we just want to make sure that those sick days are not taken from them for just trying to keep themselves safe.
Dr. Bellamy, if you can respond first, and Dr. Barnes, if you can comment, I'll be happy to follow up.
So I will say that many of our teachers began in January traveling before we were able to announce our rollout. And at the time, lots of them were teaching from parking lots and virtually, just like this gentleman described. And when we were all virtual, was able to do that for sure. So what we have communicated to schools through the executive directors that work for me is that we will be as flexible as we possibly can, utilizing all of our resources to prevent our teachers from having to take sick days to get vaccinated. Primarily, that is much more easily accomplished when we're talking about those that were being vaccinated through our sites, because it's a short drive away to 100 Oaks and then back to school. I'll let Dr. Barnes talk about what HR's directive for those that had already previously gone out of county and will have to make that journey. Obviously, when they're taking a longer drive, it becomes much more difficult for the school to cover with assistants or school-based staff that way. But our directive as of now is to be as flexible as possible, and our goal would be that any staff member that needs to leave to get vaccinated through through our clinic at 100 Oaks will be covered fairly easily. And I've not heard that we've had any trouble doing that to this point. I'll let Dr. Barnes, I know his office sent some language out about specifically teachers that had been to other counties previously.
And specifically, because what I was trying to figure out if there was quarantine and isolation. We have some protocols in place in HR for that, so that our staff are not negatively impacted with having to use their leave time.
Yeah, so we've been able, over the course of the past year, even when there was COVID leave from the government we were required to do, but we're still doing now, is if you are quarantined because you're a close contact or we have to, quarantine you as an employee, we are not charging you sick leave for that time. We're also working to make sure that everyone who gets their vaccine in local isn't charged for sick leave for going here within the county. We do have those folks who did go before we got that up and running. And so there isn't really a protocol for those folks who have to get the second vaccine. I have been in communication with David Hines, who's been kind of key in the Vanderbilt vaccine, to see whether or not we could try to find a way to get them their second vaccine here so they don't have to travel. There is some issues with that because they really want you to get your second vaccine at the same location. But for anyone who's quarantined based on the fact they've been exposed here, they're not being charged sick leave for that.
And so to reiterate, the communication has consistently gone out to our school teams is to work closely with your school administration on any coverage or flexibility that's needed. It's hard to do that after the fact, so we can't go back and correct it if you went without the initial communication, but we are still urging our school teams to be as flexible as possible, allowing our certificated staff, our support staff, whomever is in need, to go and be vaccinated. And so we'll continue to share that message with our school leaders. And I haven't yet, I don't know if anybody's received any concerns to them. I haven't received any today, but if there are any concerns about that, if we can encourage our teachers to work with their school team to help rectify that, that will be most appreciated.
If you haven't had the chance to, I'm sorry, go ahead.
Oh, I was just going to say, I know several people personally who have gotten their vaccines, their first and second, in different locations, different counties. As long as it's the same version, as long as it's the same Moderna or the Pfizer or whatever it is that they get, they can get it wherever, as long as it's within their time frame, appropriate time frame, and the correct level of whatever. Yeah. So I'm not sure if you guys are getting different guidance or if that's just kind of happening off the books, but I know for a fact that is happening, that people are getting the same vaccine in different counties, their first one somewhere and then their second one in a different county.
Thank you, Ms. Tyler. I'm obviously I can't speak to what other counties may be doing, and of course believe what you say. Our partner, Vanderbilt University, that's doing our vaccines, are not doing that for second doses. They have to be really clear about their operations, and that's the guidance that they've given to us. And so that's the answer to that.
I'm sorry.
I was going to say, we can pick up the rest of this after the Dr. Battle's report because it might be covered in what she's going to explain to us. So we're going to go through consent agenda, and then we'll pick back up here.
Okay.
All right. All right. Are there any questions? No, I'm sorry. Do I have a motion to accept the consent agenda as listed? Or are there any amendments?
Still moved.
All right. We have a first and second. We have a motion and a second. Any discussion?
Do I need to add to the consent agenda to make a request to add Mahari, or are we going to just be
Hold on, I'm sorry.
discussing?
Say it one more time.
Can I make an amendment to the consent agenda, or are we going to discuss Mahari? Do I need to make that?
Mahari's not on the consent agenda.
Right, I wanted to make the request to add Mahari on the consent agenda.
No, we can't. We can't add this since it's a contract that's already been voted on and approved. If you have questions about the Mahari contract beyond what Mr. Johnson has already answered, then after the report, you can file in line then.
I think with our policy, 1.403, we can add to the consent agenda.
No, that's not right. You can't answer the consent agenda. The consent agenda is just for contracts. We've already approved that contract, but we've already baked in time at the end after her reports for the rest of the budget hearing, so we can continue to talk about the Mahari contract then.
Okay, just for clearance, TSBA advised me that we can add to the consent agenda. So just so we'll be clear, and if we need more clarification, I'll get with Ben Torres so he can do that.
Sure, sounds good to me. All right, any other discussion? All in favor, please raise your hand. All right, unanimous, with the exception of our two that are missing. All right, we'll move on to director's report. After the director's report, we'll move on to your statement, Ms. Masters, or your questioning, and then Mrs. Player-Peters finished up with budget, which will encompass the Mahari Venture contract. Thank you.
Thank you. Good evening, board members. I'm excited to be with you for our first meeting since we returned to in-person learning district-wide for all of our students pre-K through 12. As of Wednesday, all students who chose the in-person option have returned to the classroom. As a recap, the schedule for students to return to classrooms for those parents who chose the in-person option and contingent upon continued success in containing the spread of COVID-19 started with students with special needs who attended contracted special day schools on Thursday, February 4th, grades pre-K through 4, and students with exceptional needs who were identified last semester as needing in-person instruction on Tuesday, February 9th. Grades 5 and 9, transition grades for middle and high schools returned on Tuesday, February 23rd, which was delayed from our original plans by a few days due to the winter storm. Grades 6, 7, and 8 on Friday, February 26th. And finally, the remainder of those students who are returning came back on Wednesday, March 3rd with grades 10, 11, and 12. Just as a reminder, we surveyed parents over the summer in September and gave them the option to change their decision in December as to whether they will return in person or remain virtual as conditions allowed, while also informing them that they will return in person if families did not respond to the many emails, calls, and notifications about the process. It's wonderful to see students at all levels back in our school buildings, while we also continue to serve the many who chose to remain in the virtual environment for the rest of the school year. We work every day to provide a high-quality education to every student, no matter where they are. Today, our risk score is 4 out of 10, with continued improvements in our positivity test rate and 7-day average of new cases per 100,000 residents. The spread of COVID-19 has been reduced, but the threat from the virus still remains very real. Inside our school buildings, we see cases daily. So please, everyone, even if you've received your vaccine, continue to wear your mask and practice social distancing so that we can prevent transmission and protect ourselves from the virus and the need to quarantine. More than 7,000 MNPS and charter school staff have received their vaccine through our partnership with Vanderbilt University. At this point, we're only seeing a small number of new employees signing up as we have met the needs of those who are eager to receive the vaccine. And staff will start receiving their second shot this Saturday. We conducted a survey over the last week to hear from our staff what their thinking was around vaccines. Of the 3,267 employees who responded to the survey as of this morning, about 78% had received at least one dose of the COVID-19 vaccine. The survey also found that 80% of staff received the vaccine here in Davidson County, while 20% went somewhere else to get their shots. For staff who did not receive their first dose, 80% or 580 had not yet scheduled an appointment to receive the vaccine. 43% of those employees who have not yet scheduled an appointment intend to get the vaccine in the next 12 months, while 50% said they weren't going to receive it. So, of those who said they were going to receive a vaccine in the next 12 months, about 30% plan to get it in March, another 30% by the end of the school year, 23% in the summer, and 15% were planning for either the fall semester or 2022. Only about 9% of the employees taking this survey said they simply weren't going to get the vaccine at all. Many said they wanted to see more data and long-term research on the efficacy of the vaccine. Some had personal or unique reasons for not wanting it, and a few just don't believe in the vaccine. Of course, it should be stated that this survey may not reflect the total population of MNPS employees, as it was optional, and those who are least likely to take the vaccine may also be least likely to take the survey. However, we believe it gives us a strong sense of what employees are currently thinking. Now, I want to take a few moments and talk about our testing and safety protocols. As we talked about earlier, we have a partnership with Meharry Medical College Ventures, and it has begun to ramp up. They've begun to ramp up their operations after this contract was signed in February. Last week, they began rapid testing at a few of our elementary schools with students who have signed consent forms. And this week, their mobile testing teams have been activated to address potential hotspots in 2 elementary schools. For the first time since the pandemic began, we were able to get real-time data and precisely isolate risks. This has 2 major benefits. Most importantly, we can help protect people's health by identifying those who are positive quickly and isolate them. Nearly as important, we can be more confident in who is not positive and be more precise about who needs to quarantine. This planning will help us to keep in-person learning an option, not just for the district as a whole, but for individual schools and classrooms. We look forward to the continued ramp up of this project as we move forward. And before I close out, I want to give a quick shout out to all of our social workers throughout MNPS who do such important work to meet the social, emotional needs of our students and their families. This week is School Social Work Week. In March is National Social Work Month. As you saw from our budget presentation earlier, we would love to expand the number of school social workers here at MNPS to further expand the wraparound support we offer. And finally, I want to thank you for your discussions and attention to the Teaching and Learning Committee earlier, where we talked a little bit about our Literacy Reimagined kickoff. I want to say that I'm excited about our Metro Schools Literacy Framework kickoff this Friday at 12:30 p.m. We have been working for months to develop a literacy framework that will strengthen and accelerate, and I heard that question earlier, and accelerate the reading skills of our students, and I'm looking forward to sharing that with our staff and the public at our kickoff. So I know we're not closing out right now, but I would say I look forward to seeing everyone Friday at 12:30 on our Teams channel. Thank you.
Thank you. I'll open it up for questions or statements. We'll start with you, Mrs. Masters, just because you had a question before we were able to begin.
Thank you. I'm glad I wrote it down. So I'm wondering, so for teachers who become ill as a result, and we know a lot of folks are getting sick after, especially the second dose, and need a few days to recover from that. What is the policy for that as far as sick leave days that may be required? And I think that's what Mr. Becker, I think he was speaking about having to go and get his second dose, but he also, I believe, was speaking about having to take some sick leave days as a result of that.
Right now, we're tracking about 30 to 45% is what it says become sick from it. So we are asking folks to use their sick leave if they need to, if they do find themselves with a reaction. Mostly from the second dose. I haven't heard much from the first.
And that's no matter where you receive the second dose?
I think, yeah.
Okay.
Yes, ma'am.
Thank you for that. All right, other questions or comments?
Yeah, I just wanted to kind of continue to follow up a little bit. Looking at the guidance that was sent out to our teachers, it just feels like the teachers who took the initiative to go protect themselves so that they could come back and teach, which is what everybody has been wanting them to do for the most part, so that they could keep themselves safe and get back in the classroom. They took it upon themselves to go out of county to get a shot, are now being punished for making that safety choice by not being allowed to take that sick day or not being allowed to not be charged a sick day for their second dose. So I just had to make that statement because it really does feel that way for those teachers, that they feel like they're being punished for taking the initiative to keep themselves safe. And I agree that it's very frustrating, and it does sound a little bit not quite fair.
All right. Any other questions or statements or thoughts?
Is there some sort of circumstance where we could, retroactively give them back the sick leave days that they've had to take to go get a second dose elsewhere?
Well, I'll say this, we should not be in that scenario with second doses at all, because that communication has gone out, and I have repeatedly communicated that I never felt that we should have been in a place where our employees should have to travel
Exactly.
to get the vaccine. And in most of these situations, even prior to kind of the official announcing, work with your school team, that's what would have, we were in the all virtual space at that point in time. And so if a teacher has a question about it, again, I encourage them to work with their school principal, who can work with their executive director on if there are spaces for adjustments or not based upon their individual circumstance. Again, I don't know everybody's individual circumstance. I've not even received a direct question about it. And so what we typically do when we see things like that, it'll go through the school principals, up to EDs, to Dr. Bellamy, then we can sit and make a more informed decision if we're seeing consistent action across the board. But this requires of us to have proactive planning and communication so that we can rectify as many needs as possible. And by our approach of being a support hub, that's what we want to do. But it does take proactive planning and communication.
Yeah.
So again, I would encourage everyone to work closely with their principal and their school team.
I know. I'm just looking at the actual guidance that was sent to teachers, and it says, leave taken from the normal workday to receive a vaccine that is not administered through the upcoming Vanderbilt vaccination process will be charged to the employee as sick leave. So it seems like the guidance for out of county is to charge sick leave as opposed to work with the principal. So I just, is that something we can change? Can we make that work with your principal?
I want to clarify, now that we have the partnership with Vanderbilt, we need to leverage that partnership, because we thought through logistically how to best support both the personal needs of our employees and the educational needs of our students. And so it sounds like in what you just read, that was specific to now that we've launched our partnership with Vanderbilt in administering the vaccines. We can definitely funnel any specific inquiries about it through principals to EDs. We will always look at them and make the most informed decision around what's best, but it will take some communication. I don't know the number of circumstances that are out there at this point. We were trying to survey to get a gauge of how many went out of county, but that and the proper communication will help support.
So are principals currently empowered to forgive that, like to not charge a sick leave day for someone who had to travel out of county to receive a second dose?
Or will have to travel out of county?
Not if they're going back.
Because if they've already used it, you can't
Yeah.
get it back. But if they have not gotten their second one,
Right.
are they empowered to say you
Absolutely.
don't have to use that sick
Absolutely.
leave?
All right, thank you all for that clarification. Other questions or thoughts? All right, I've pulled up policy 1.403 for you, Ms. Bush. For a regular board meeting, the agenda which shall include the consent agenda together with supporting material shall be distributed to board members at least 5 days prior to the scheduled board meeting. So we can't add it to the consent agenda because that has already gone out to the public. It's been publicly noticed. But because I am a kind chair, we're going to have the discussion now to make sure that anyone who has any other questions around Meharry or around that contract can have those asked and answered on this board floor. And then we'll add the 15 minutes for any other questions for you, Mrs. Player-Peters, around budget.
And you know, I misspoke. You can add an item to the agenda.
I can't hear
I know
you. Say
this
it again.
math, right? I said that we can add an item to the agenda, so I misspoke, not the consent agenda. So I misspoke.
Exactly.
So
That's
you
what
can add it to
I
the
said what I
agenda.
said, so that's why I wanted to make
I just
sure
want
that
to make sure that I misspoke and I was going to make that correction.
No problem. I got you. All right. So questions around Meharry?
I have one.
Go right ahead.
So I was looking, I pulled up the contract to look at kind of that one-time cost and the monthly cost, not including kind of the a la carte things that I noticed. And just adding it up for 4.5 months, I see that, you know, with the one-time cost and the monthly cost that are non-negotiable, we would be spending roughly about $13 million. And that's for the 4.5-month time period. But when we voted for the 11.5-month time period for the same amount of money. So I'm wondering, it just seems kind of, I'm trying to wrap my head around it. I just would love some clarification on if 18 million, if roughly 13 million is what it's going to cost for 4 months, then why didn't you ask for more for 11.5 months? And if 11.5 months was really going to take 18 million, then why didn't you prorate it out for just the 4.5 months to request a different, smaller amount for that? Does that make sense?
Would you repeat that?
Yeah, so if the 18 million was truly how much you and Meharry thought that it was going to cost for 11.5 months, when you shortened it to 4.5 months, why did we not get a different amount of money for just the 4.5 months?
Okay, I believe I'm following you. So to start with the history of how it got to this point, for many of our contracts for Metro Nashville Public Schools, the term is not necessarily the total amount of the contract divided by the number of months in the contract. For this, from the administration's standpoint, I know the term was what it was. The scope of the project was always, how do we get into school as soon as possibly January? How do we stay in school throughout the spring? And so it was a rough estimate about what that could cost. I understand that because of the term of the contract being longer, that would be as if, okay, there's something else that came up. That could be the maximum amount that we use the money for. We wanted to clarify what the original scope is so that if something changed and we needed to go longer, it actually is more accountability to come back to the board because we could not extend the term of that contract beyond that amount of time. So the scope was always for this amount of time, but as it is backed up into taking longer to implement, that has meant that we're spending less money because there's less time of doing that work for the services. Then we did not ask for an entire amount for a year because we did not anticipate going longer into it, to answer that question.
That makes sense. If you knew that on the front end, I wish we had known that on the front end as well.
I think a lot was adjusting very quickly. And so the January 12th, we presented what we thought at the time of this giving, that's a maximum amount that you could do for emergency contract. That's why it was brought to you in that way.
And I do want to say, I did do the math for the monthly cost, just the monthly cost, and I know that Dr. Johnson said that about 400 people who you're going to employ through this. And if you don't, if every single penny goes to one of those 400 employees, they'd be making a little bit less than $35 an hour. So that's not a huge amount of money. So to me, that does seem like a fair amount. And then you also take into account that some of that money is for technology and infrastructure, so it's not even going to be a full $35 an hour. It's going to be even less than that when you prorate it out based on how much is not being spent on human beings, but things. So I did want to note that to everybody who's listening that feels like that's a giant number that seems too much, that it actually breaks down to a much more reasonable hourly rate. Did you want to add something?
I think, because I'm not a great mathematician, but I think when we broke this down over 22 days in a month on average in which someone is in school, and the number of days that it will take to go through this, it's roughly about $500 per school.
A little bit more than that. But
yeah, invested per school per day. To carry this out. And
between 500 and 1,000.
Yeah, to carry this out. So we've tried to make this as cost-effective as possible to give, again, the best solution that we could, spending the resources both on human capital and technology and the support of the technology to make that happen.
To further put in context to your point, Ms. Tyler, another contract that this board has approved for Metro Nashville Public Health Department to provide nurses, that contract for 127 people for about $4.3 million a year or so, or a little over $11 million per year, that comes to about $7,300 per employee per month. This contract is about $4,900 per employee per month. So it's a good bit less than what we're paying with the Public Health Department, which is a public entity, and that just puts it in scope. I think an important thing to remember is the scale of the district. Anything that we do touching every person, even if it's a little bit, adds up to a large amount. And it's just a nature of how many schools, how many students, how many people we serve in our district.
All right, thank you. Ms. Tyler, did you have any other questions or comments?
No, I guess the only other comment is one I've already made, just that, it seems like 18 million is appropriate for 4.5 months based on what they're doing. And I just wish that we had known it was 4.5 months going in. And I would love for that to be something that is made clear in the future. If we vote on a long term, but it's not going to actually be, that to me needs to be made clear beforehand. But it does seem like appropriate, especially once you told me the number of employees. I was able to do some quick math, and that does seem very appropriate. So thank you for being here to answer these questions.
Other questions?
I have several. The first question I have, I guess Hank, you may want to come back up. You want to come back up? Okay. When we look at 400 staff members, that's projected, right? So we may not need that many staff members to be able to justify the expenses. And the reason why I say that, because I know me and you have had discussions about how many students have opted in for the testing. Do we have a number right now?
We have a number for how many students have consented to the testing. No, they're still building that. So.
Okay, so if we're still building that, what will be, is there a cutoff? Is there a timeline for that so that you all can start the process? Because we got into June 30th.
They have started the process. So, for example, they tested in 4 elementary schools last week for the students that had consented. And so they're continuing the process. But we know that parents need to feel and employees need to feel as safe as possible in their school environment. And so we want to make sure that if a parent decides later on, oh, actually, I've heard about this experience now, I want to be involved, we hope that parents still sign up, because the more people who are tested, you get a better sense of what's happening in that community, and even helps the people who either are not able or not comfortable feeling tested. But to go to your first point, this contract is not just handing over a set of funds to Meharry Medical College. They earn every penny based on the scope of the contract, what work services they actually have performed. And so it is prorated. That's why the contract is so complicated, is that it's really clear about what they have to provide. If they don't provide it, we don't pay for it.
And this is for the viewing audience. This is for stakeholders who want these questions answered. These are for parents. Even for me, I want to know, because with $18 million over a 4.5 month span, that is a lot of money for that period. When we agreed or voted on 11.5 months with the same amount. So you can kind of understand why it's such a huge question in the community and those who are having concerns, like myself. So my next question, and before I do that, so it's still not a complete answer as to how we calculate the number of those who are opting in order to justify the amount of money that's being spent.
We unfortunately don't have the option to build something based on when people tell us what they want something. We had to build a complete system that's set up to accommodate the needs of the students who are on the ground. So for example, let's say that a small number of people wanted to test at first, and then they saw how well it was going, and then a large number of people wanted to test. We wouldn't then be able to go back and build something from scratch. We have to build it comprehensively from the beginning, some of which can be adjusted depending on the ramp up and how many are actually being tested.
So do we adjust the amount of employees accordingly to the testing, those who've opted in? Because we've got a set amount of 400 people that are supposed to be staffed.
Yes.
So are we kind of...
We're ramping up, and then...
And then we don't have to ramp up?
That's right.
Okay.
We don't have to go to that full amount.
Gotcha, okay. All right, just wanted to make that clear. And then, of course, the question is being, why a no-bid contract? We talked about the emergency status and the reason why, but if you can explain again why a no-bid contract for this particular contract.
This was an emergency contract in an emergency situation of COVID-19. So we knew there needed to be something done to be able to create as safe an environment as possible for our students and teachers and other staff members. We did not know if there would be funding available. Funding became available within 3 weeks of when we might have been back in school. Even then, as we've seen by how long it takes to get this ramped up, if we wanted to do something for our schools to get back in this emergency COVID-19 situation, we had to go the emergency contract route. If this were to continue, we would bid it out because it would no longer be an emergency situation. But this is where we are now. And it's the same emergency contract provision that the city used as it contracted with Meharry Medical College to do the testing sites for the city.
And is it legal? Is it legal to do this with federal funding?
Yes, it's legal, and this is, we do not take illegal actions.
Tell me how you got involved with signing this contract. Normally, we go through our COO, Chris Henson, or someone that is involved with contracting with grants. Tell us how, the public wants to know this, so I'm asking these questions. Tell us how you became a part of signing this contract.
So as you might remember back to the budget presentation and other presentations, we have 14 signature initiatives, and this is one that I'm responsible for because it impacts the entire scope of the district, and I'm proud to be a part of it.
Okay, so why was it important to shorten the contract from 11.5 months to 4.5 months? And how does this shorten the contract meet the goals of the district?
More accurately reflects the scope of the contract so that now we are limited that let's say we thought it was necessary to continue testing into the fall, we would bring it back before the school board for you all to vote again and decide whether you think this is a good use of funds or not.
So why wasn't it brought back before the board when the adjustment was made, when we approved one amount, one timeline, or one term? Why wasn't it brought back to the board for the shorter period?
Because it was not seen to be a material change is the answer. And I'd be happy to defer to Mr. Burge if there's further questions.
How long does it take for a contract to be bidded out? What is the process? Because I think it was being worked on back in December. Is that correct?
So your last question about when it was being worked on, the president signed ESSER 2 into law on December 27th. We didn't know if there would be funding until then. We brought it to the school board on January 12th. In terms of a bidding process, I'll let Mr. Gossage, Mr. Hinson, if that's okay, if Mr. Gossage respond to that.
Typically, a contract like this would take about 3 months from start to finish. And keep in mind that schools have pushed back the full start. We were rushing as fast as possible to have a contract in place that would meet the needs in time for the school return. And so there was just not enough time to go through the full competitive process. I will tell you, I challenged Hank on this about the need for an emergency contract. I even carried it to legal to be sure that we were on good footing. They confirmed back that we were. So that's a normal give and take, and that probably delayed the process some as well as we were vetting what we were doing. So.
My last statement is, I have a couple of last statements. I spoke to a couple of council members this morning who was really concerned about the behavior of this particular contract, the amount of money and the term limits on this contract, and it questions our budget. And that's what I worry about. That's what we should all be worried about as far as how we are being fiscally responsible when it comes to government funding. So my hopes and my concern is that we are using these funds for the items that are being serviced. And that's something I think you and I talked about, is making sure that every item that's being paid, its service is rendered, and that we're not being in any way egregious when it comes to this particular contract.
So this, Ms. Bush, this contract, like all of our contracts with Vanderbilt University Medical Center, with Kroger that does health services, with our insurance providers, with everybody else, are always done legally, are always for services that are performed, are always done by our internal policies and procedures, state law and federal law. And if there's anything that's ever brought to our attention that's anything differently, we work to correct that immediately. This contract, like all others, we will ensure that the work has been performed, that's been performed as allowable by the stipulations of the grant. And if it's not, we won't pay it, because that's how the process works for this and every other contract. We have full faith in our partners at Meharry Medical College. The President of the United States has identified the head of Meharry Medical College to serve on his 12-member task force around COVID. We're lucky that they're willing to partner with us. We're fortunate that they have served the city with the COVID testing centers for the past year. I don't know where we would be as a city without them. We're glad that they're using the lessons learned from that to serve our students. We're glad that it is helping to make our schools protected against the dangers that so many of our families have faced. There's 2 examples recently where people started becoming positive. The Meharry teams went in, identified the scope of it, are testing to identify who's positive, so that we can be very specific about who needs to be isolated, who needs to be quarantined, and who doesn't need to be, which is equally as important.
And
to the question too, so this, what I would be talking to with our friends on council is, this is exactly what these federal funds were meant for, is to help us to get in school, to stay to in-person education, to stay in in-person education as long as possible. We're fortunate that we didn't have to use local funding to be able to do this, that the Congress stepped up to provide this. We're glad that they're providing another round. And honestly, I'm looking forward to this to be in a national model that other school districts could follow as well.
Yeah, I never questioned about the integrity or the scope of the work that Meharry can do. That's not the question. The question is the amount of money and the term that it lies in. And those kind of questions were asked and are questioning by city leaders, by constituents, by stakeholders. So these are questions they want answers to. So this is something that needed to happen because there's been so many questions circulating around this particular contract. So I'm not questioning the integrity. What I am doing is allowing our community to hear what this is all about and how it was formed. So I think it's only fair that we give them that. So that's the reason why these questions have come up. And again, my recommendation is that every line item, everything that's being submitted for purchasing or payments, it does not need to be at a level of just to drain the money. It's for services rendered. And we just want to make sure that those practices are taking place.
This contract is for services rendered. They are, like other contracts, this is how we handle it, just as we talked about with a comparison to a few other contracts that the board hasn't asked about yet. Those are exactly this, very similar funds. They're in line. It takes money to run a school district. We can't ask people to perform services for free. And when you add up the amount of people that it takes to serve for this project, it just adds up to a significant amount of money.
And I understand that, and I'm not asking for anybody to get paid for free. That's never the case. You have to understand what I just said is I've been very transparent about it. And we're still collecting that information from our students. We haven't even reached that point yet to even be able to start being so egregious or aggressive in this contract because we're still collecting. And we don't know when that cutoff is going to be. We don't know how that's going to work month to month. So that's what I'm saying. According to whatever is being worked is what we want to see as far as being paid. Because right now, you can't give me a number of how many students that we have. Do you have the number of students we have so far? I think Mr. Johnson's coming behind you.
That number of students is rolling, and just for clarity's sake, I'm sorry. This is not an equally divided contract for $18 million. So as we staff up and as we test and have the volume that we need, as parents continue to sign the consent forms, we bill for that level of service. If it didn't max out on that level of service, you won't receive a bill from us at all. So the question of, is there a cutoff? There won't be a cutoff. It will always be open for consent. Also, the electronic consent forms allow for parents to deconsent, or that's not an education board meeting. Remove their consent if they choose to do so. If their child had a negative experience and they don't want to do it, they will be removed from the role. Other parents might speak at a PTA conference and say, my child had a wonderful experience, and then 10 more parents decide to consent. It will remain open, but again, rest assured, you will only be billed for services that we render up to $18 million. It might not make it that far between now and the end of this contract. It's just enough for us to perform. I hope that answered your question. I'm not sure.
Yes, it did. Okay, so that's the end of my questions. Thank you.
Thank you both so much for the explanations, doing the deep dive. And I'm sitting here like dancing, trying to, I know as chair, I need to mince my words because I don't only speak for myself, but I think this is a good civics lesson for the community at large. This is good for everyone to understand the way our contracts are presented to us, that they have a cap, and what we vote on is the cap. So we're not saying that we are paying $18 million today for work and, despite what the scope might be, we're saying we will not pay more than $18 million throughout this year unless it gets brought back to us for another vote. That's the same for the time frame. We've had, and this is where I have to mince I'm fighting to decide if I should mince my words because, forget it, I'll be the pariah and be called a race baiter. I do think it's interesting that we continue to have these kinds of conversations around institutions that are a bit more diverse because this happens all the time with MNPS contracts around institutions we partner with that aren't diverse. But we never seem to have that conversation, or we don't hear the conversation in the community at all. So I would urge the community to continue to engage us, but understand that this is how contracts roll out. And when we voted back over the summer to allow for emergency provisions, to allow Dr. Battle and her staff to work to make sure that we could move to the in-person space as quickly and as safely as possible, we allowed for emergency stipulations like these contracts coming up very quickly because we knew we were hearing from the community that they wanted to be back in person. And so here we are trying to work to get you all back in person. And I do think I've taken offense to some of the things that I've heard represented about MNPS staff around the partnership here with Meharry. And so I hope that we have dispelled all those rumors. I think we've had a very open and honest conversation on this board floor. I hope we can continue to have that. But I was born at Meharry, so I know I'm biased. I love the institution, but I just appreciate the work that they are volunteering to do with us because they didn't have to. Whether they're getting paid or not, they could be working with another school system. They could be working with another institution. And I'll just stop because I could go on. But Mrs. Elrod, and then, of course, we'll pick up with any other questions, and then we'll kick it to you, Mrs. Player-Peters.
Thank you, Madam Chair. My question is in regards to the consent forms. I am glad that we're continuing to receive consent forms as the year goes on, as ideally the program hopefully expands and we're able to better protect all of our students and staff. When we are collecting those, I know that we've pushed that out to parents and have asked them to do so. Do we have a current communication plan, or are we encouraging that through our navigators or anything like that to encourage signups or enrollment into that? And then additionally, I guess built into that question is if we're reaching out proactively to families to encourage them to be involved in this for all the proactive reasons we've discussed, do we have somebody that they can speak to, or do they just simply call our usual helpline number to get information about data collection and other concerns that they may have?
As Hank is approaching the podium, we feel very strongly that it should continue to be open to parents to enroll as we close out the school year and move into the summer. But Hank can talk very specifically around our communications plan and how we're trying to keep this option available to our families so that they can have these mitigation strategies in play in their schools.
And I wish that the picture was still up of those cute children in the room getting tested. The short answer, Ms. Elrod, is the communications will never end for this. We want people to be very well informed. We've gotten excellent questions from some of your constituents asking about the very particulars of because it impacts their child. I know that my 5-year-old daughter, I would have questions about what's going to be impacting her as well. We are adjusting real time to what is happening. This is a one-to-one relationship, and so Meharry Medical College Ventures, which is rolling out some additional communications that you'll be seeing. They're rolling out a website to help people to make it very easy. They're expanding the languages in which we're doing it. As you saw, Tusculum was a very diverse student body, and I'm thankful for that. But the biggest communication tool is going to be from parent to parent. As they experience what we hope to be a very positive experience, and they tell their other parent friends about it, I hope that they'll do it. There'll be some people who either don't feel comfortable or medically not able to do it. It helps to keep those people safer too, because we have more data about what's happening in that school environment.
Thank you. As I've said on the board floor for since maybe the beginning, that was a big proponent of us doing testing, whether it was batch testing or individual testing. So I'm glad that we're doing it, and I think it's by far the best way for us to mitigate any potential risks that we have with super spreader events, particularly as the new variants come out. And I think it's probably the best practice for us to not only keep people safe that have been vaccinated, but to your point, those that have not been vaccinated or choose not to be for whatever reason that might be. My hope is that we continue to have that communication. I'd really like it if we could see within our newsletters that the schools send out an encouragement from individual principals. As we have seen, even through the data that was shared through the rector's report, there's still some concern about vaccine safety and getting that vaccine not only within our own staff, but within our families. And so my hope is that a more personal approach through individual principals and individual school newsletters and that kind of thing will have more of an impact on parents not only agreeing to do vaccinations for themselves, of course, that's not this conversation, but of course doing this testing and of course helping us protect our schools as a whole. So thank you so much.
And I'll just say, Dr. Bellamy is sitting here, and we'll continue to encourage our school teams to push out that information as well as the communications around any leave for being vaccinated. So we'll continue to do that.
Go right ahead, Ms. Masters.
Thank you. I just want to say to this same line, and I have been sending a lot of questions on behalf of my constituents about the testing. Questions like, are these providers used to dealing with pediatric patients? The answer is yes. How often will children be tested? No more than every 2 weeks. Will they be told ahead of time? Well, they'll know what day they do the testing. So you can say to your child on Tuesday, hey, tomorrow's Wednesday, you might get the nose swab. And in one of the elementary schools in District 3, where the parents are getting involved with spreading and sharing this information, and we already have 130 out of 350 students signed up and growing. And so I personally want to get a lot of bang for my buck out of this. So I think these are the sort of things, I want those questions and answers to be out there just like so readily accessible, and to be encouraging not only school leaders, but parent leaders and community members to spread the word about that. Because I think with the information, then they feel more comfortable signing up. And I know in that same elementary school, we were able to do some really fast quarantines. And the school nurse is a happier person right now too, because it was really hard on her. So I think when the terms of this contract are working very well, that's an example of what that can look like. I'm very appreciative of Meharry creating a website to share this information, and I think we should really spread the word about that far and wide so that we know we're getting value for our money.
And point well taken, and we'll continue to push out and get some of those frequently asked questions about the process out there. And I think the team communicated, as we're learning new things, we will be adjusting, but we will continue to push out that information and answer those frequently asked questions that are easily able to be answered.
All right, go ahead, Mr. Player Peters.
I just personally want to thank Mr. Johnson for coming to our basically political theater. And just as a doctor would have to go through the scrutiny as a postmortem, as they would, that you have come before us and willing to take the tough questions about the validity of the contract. And so I want to really thank you for that, because I know it's not an easy thing to come and deal with these questions, and you've handled it beautifully. So I want to acknowledge your work and your stance for that. Also, someone who's worked on the other side of Metro government, this is not the first time Metro government has worked with Meharry, and I think they're used to this dealing with taxpayer dollars. But also, we're in a pandemic. We're in an emergency aspect. And we are blessed, as Mr. Clay and Mr. Johnson said, that we are in a space where we have the best medical expertise in the country. Throughout this pandemic, on the state level, on the Metro government level, even our level, this is not the only emergency contract that Metro or a Metro government entity had to engage in. We will ideally, and that's why I think we do have a fiduciary responsibility to make sure tax dollars are spent for. In a pandemic and emergency, just like there's a tornado in FEMA, there's times where it's not efficient or effective to do a full bidding process. We saw that even with the governor when making masks. I think the big difference is we have a national leader. Dr. Hildreth is an infectious disease doctor. He's been doing it his entire career. Dr. Fauci came to Meharry to do a symposium about infectious diseases. We are engaging with infectious diseases with variants changing on a daily basis. There is times if we want to bring our children to school, we've had that long, complicated discussion, what it takes. As Budget and Finance Chair, I would love for us to go through every hoop possible. But in this unusual and unprecedented time, we do not always have that luxury. And so the fact that's why I think for coming after the fact, because I know we already approved the budget and been willing to go through those rigors, because I know Meharry Middle College has done this before. Sitting in the mayor's administration, I have had tough discussions with Meharry, and they have answered the call every time. So I know from personal experience in a governing aspect of what Meharry is willing to do and willing to answer. I'm sure won't be the last time we'll see Meharry at this part. But if we're going to especially prepare for the next school year, we have to go through these circles to do this. We have to have certain protocols. And I know it's not ideal. It was an ideal situation. If we could put pause on time and pause on everything, we would go through a much rigorous process. But that's like us having Harvard, being in Boston School District, and having Harvard Medical School at our resources and not relying to them. Dr. Hildreth was standing next to the mayor for months on a day-to-day basis, giving us the cutting edge, breaking down medical reasoning, medical protocol, infectious protocol. I probably learned more than I ever would have at my time in high school or at Fisk. So I think that as we go through this is not ideal, but it's an emergency, unprecedented situation. So we're going to have these contracts to keep our children safe, that we have to go through we have to enter in some of these contracts in this way, but there's a reputation, a legacy that already exists currently and in the past. You know, Meharry Medical College has had a great legacy, history, and current part of public health. They are public health medical institution. And so they are the ideal partners for this, and they're known for this. So I understand parents' questions. They have the right to bring questions, and we have the right to answer them, and they should be answering. So I don't want this to seem like I appreciate my colleagues bringing these questions up because they need to have this full-throated, full, thoughtful conversation and understand. And as we can see from today, Meharry has met the task. They've answered every question, they have explained everything, and this contract is not unusual. And so I hope as we go on, we move, that we have the same questions. The same way we enter in a contract with Vanderbilt clinics, the way they're administering doses and they're actually giving shots to our employees. We have the same rigor, and we bring the postmortem of a contract with them too also. But also, we have to understand the resources and the expertise we have in our hometown and be able to use that and show our students, show our employees that you always don't have to go outside when you have the very best in your backyard. So I just want to say that, thank you for the conversations. Thank you for the questions. Thank you for being transparent with it. I know this contract was not probably as smooth and ideal, and that's something we'll have to continue to prove on the contracting process, particularly when we're doing an emergency situation. But Meharry is not a sock maker making masks. They are a leading, thoughtful, cutting-edge medical institution that produces top-notch medical employees and doctors on a yearly basis. So I just want to put that out there that I think it's very thoughtful that we're having this conversation, but also realizing this is not the norm, and this will never be the norm again. Hopefully, prayerfully, we will never have a pandemic again. But in this unprecedented time, these measures are not unusual for an emergency part. And so I just want to say that as we continue to ride out the rest of the pandemic, everyone please double mask like I am, get your vaccinations. So when we start the new year, hopefully We don't have to use Meharry because we're in a healthy part, but we'd be able to use them in another partnership that brings the health of our students, whether it's an academy or whether it's using a clinic like we have with Vanderbilt. But it's this unusual time. So thank you to the parents for asking these questions. Thank you to the school board members, my colleagues who are bringing up these questions to show that Meharry's up to the task and being thoughtful about what we're doing with our dollars, because as anybody knows, I am a budget taskmaster, and I want to make sure we use every penny. But as we go and facilitate, I'm just going to roll into the budget part. As we go and to advocate for our budget to the mayor, we can't cut anymore, y'all. Like, we've taken every haircut that we have taken over the past several years. We are trying to be the best in Tennessee in educating, and that's more than educating a child with a textbook. We have to create a safe environment to do that. And to do that, we have to advocate. We can't do the maintenance and budget. Just the maintenance effort budget that Mr. Henson and Dr. Battle present, it's another $50 million that we have to do just to maintain the same level of education that we're doing now. We just had a teaching and learning thing. Dr. Bellamy talked about professional development and that we have to make sure our teachers to be comfortable that if we're going to have this whole compensation study that the mayor hopefully is going to fund, and I ask and I beg and I pray that he funds that compensation study, that we have on continuing PD. But we have to have a safe environment for our students to learn. And to do that, it costs money. And I wish it didn't, but it's the reality of where we are today in this time in the pandemic and coming out of the pandemic. Our goal is to educate kids and what it takes to educate kids. And that's being safe. And that's to get safe is give them the teachers they need to provide services, the support staff to do it, the textbooks to do it, and then also the professional services that our teachers, when Dr. Barnes comes to recruit and we give them the best salary in the nation, that we have to have an environment to continue to make them want to stay and live here, that we don't have a recruitment deficit. And so as we advocate for the budget, I'm asking my colleagues to advocate to the mayor to continue to give us the funding that we need. Because at the end of the day, all this is about to create a safe and healthy environment to fund and educate our children to be the best in the county, best in the region, best in the state, and hopefully best in the nation. And Dr. Bowden and her staff has been turning that around. We have been cutting edge in her short tenure that we are now in the national pilots for various programs. And to continue that takes money. After that takes money, and our job is to oversee. So we will continue to hold contracts accountable. We will continue to advocate for funding. I'm asking you, and I hope we'll provide talking points, to first advocate to the mayor to give the most money possible where we are. We're coming out of this time of the pandemic in a better, healthier economic situation than we thought we would be, so we can have those new funds to go to education, because we can't cut anymore. You see, if it was not for these CARES funds, we could not enter that Meharry contract. We would probably still be virtual right now. And so luckily we had that opportunity to maximize that one-time funds. So now that Dr. Battle and the rest of the staff can leverage that, so now we can get back to our new normal. So I hope as we move on into this, to the next budget meeting will be on March 23rd. We take the community meetings that we'll have this Saturday and next Monday, take the input from our parents and from the teachers, bring that to the work section on that Tuesday, the 23rd. Let's have a good work section, talk through all the contacts and all the different points of our priorities that we decide on the retreat, and make sure we can have a full-throated, thoughtful discussion, just like we had tonight, to the entire budget. And so when we go to the mayor's office and ask for that money, we can say we are good financial stewards of our taxpayers' dollars. And we're here to educate our kids. What's the vision for our city, for our kids, when it comes to education? And if that's our vision and our dream, are we going to put our money where our mouth is and fund it? Because at the end of the day, if we're going to be the best, it takes money. And so hopefully I'll go to announcements. I'll say what I need to remind them about the community meeting, next meeting, but we're going to have the next 3 weeks after spring break to really go through and make sure we advocate for the best so we can be the best in the nation at educating our children.
Thank you for that. Mrs. Player Peters. Go ahead, Ms. Pooper-Walker.
I just want to second everything Frida said, and thank you, Hank and Mr. Johnson, for all the responses and for all the questions, and important to have transparency. Anyway, I'll leave it there. Thank you, Frida.
All right, then, if that closes our discussion, we'll have a quick recap of our committee reports. But really, I cannot stress enough, this was a really thoughtful conversation. Let's keep this up, board. I appreciate it. All right, we'll start with teaching and learning.
Okay, so in the Teaching and Learning Committee, we were presented with the January MAP results, and they went through that, broke them down by the different races, by the different economic status, by ELL, and so that we could get a clear picture of how the district is doing up to this point. And then they also spoke a little bit about this new Literacy Reimagined, and I just want to go ahead and encourage anybody who heard that or wants to know more about that to tune in at 12:30 on Friday to learn more details about what that Literacy Reimagined plan is going to look like. And we will be doing a work session to follow up because we really didn't have time to ask the kind of meaty questions that I'd hoped we would. So,
thank you for that, Ms. Tyler. All right, Mrs. Player Peters, budget.
So we'll have our community engagement meetings on Saturday, March 13th at 10 a.m. That will be a Teams Lives event. So you probably can go to our website and get the information for the link for that. And then also on Monday, March 22nd at 6 p.m., we'll also have the second follow-up meeting. So we'll have one right before spring break and right after. March 23rd will be the next budget and finance meeting. That will be a work session for us to start kind of digging through and really talking through the budget. And then I'll also help work with Ms. Elrod and then Ms. Masters to generate some talking points so we know how to present the budget and answer any questions the public may have.
Wonderful. We're going to quickly go through announcements. I'll start down here then. Mrs. Pooper-Walker.
I'll just quickly say that I had a great time last week reading to a second grade class at Waverly Belmont for Read Me Week, and it was awesome. And she took the laptop around to each kid, and they asked me questions and stumped me on some questions. It was awesome. So I'm going to leave it there.
Wonderful. Thank you. All right, Mrs. Bush.
Yes, Mr. Johnson, thank you for being with us today. Thank you so much for your answering our questions. Thank you, thank you, thank you. And I do not have any more, no more comments.
All right, Mrs. Elrod.
Thank you. As Dr. Battle has mentioned, this week is School Social Work Week, and if you want more information about our social emotional needs and the work that we're doing inside of our schools, we have a joint council and school board meeting this coming Thursday, so in 2 days, at 5 o'clock on Teams. So you are all invited, of course, to attend. You can go to our school board calendar, which is on the MNPS website, to receive that information so you can attend appropriately. It will last 1 hour. We promise. We're really good on time in those meetings, I promise. So it'll be about social emotional learning and restorative justice, 5 to 6, and on Teams. And lastly, I want to thank Aaliyah Washington Smith and her team for decorating and trying to create some enthusiasm, and I like this enthusiasm for our new literacy framework. And again, I would like to encourage everybody, including not just people on the board, but all stakeholders, to attend our meeting on Friday to learn more about our new literacy work that we're pushing out and we're really excited about. Thank you so much.
Thank you, Mrs. Pooper-Walker. Mrs. Player Peters. So sorry.
I will be Ms. Pooper-Walker. No, everyone, next week is spring break. Have a nice, safe spring break. Enjoy the warm weather. Get outside. Get some fresh air.
All right, thank you, Mrs. Masters.
Just want to echo what Frida said and say, don't go too crazy over spring break. Let's not have a spike. So
Can you say that a
maintain
little bit louder?
distance, masking, etc. Do what?
Say again.
And again, don't go too crazy over spring break. Let's not have a spike. Let's keep them all in school, et cetera, et cetera. Thank you. But, have fun within reason.
Thank you, Mrs. Tyler.
I also want to take a moment and celebrate our MNPS social workers during the School Social Work Week. What they do is invaluable, and this year we see that more than ever. So we appreciate all your work. Keep it up. We want to be able to support you as much as possible. And then I also want to take a moment to thank the City Council. They passed the Mayor's Capital Needs Budget, and we really deeply appreciate the recognition of the importance of our public school infrastructure to properly and safely educate all our students. So that kind of an investment is also a form of trust in what we do. So we appreciate that, and we hope you'll do likewise with the operating budget. And then I also want to thank Dr. Battle for recognizing the work that teachers and staff have been putting in above and beyond during all of this virtual time, and that you're using some monetary compensation to recognize that, because thanks won't pay the rent. So we really do appreciate the fact that you're putting your money where your mouth is. And again, I hope everyone enjoys their spring break. And again, stay vigilant, wear your masks, social distance, make sure that, especially if you haven't had your vaccines yet, let's keep our kids in school. All right, thank you.
Thank you, Mrs. Tyler. I want to send congratulations to the Slim and Huskies founders, Derek Moore, Clinton Gray III, and Emmanuel Reed. They are not only Nashville Public Education Foundation Hall of Famers, but they are also MNPS alum. They all graduated in 2003. They were cool kids in high school, cool kids in college when we were at Tennessee State. Now they are cool adults making history. So congratulations to Slim and Huskies. If you've not visited their downtown location and you do have your vaccine, slide on down there. I want to say congratulations to the MSAP team for continuing to support the development of young people throughout the virtual space, and now that we're back in person. Just thank you for, if you're not familiar with MSAP, we got an infusion of federal dollars a couple of years ago that will help us to implement and then maintain the STEM magnet or STEAM magnets across our elementary schools and now 2 middle schools. So just thank you for anyone that has been involved in that. Thank you for our teams, just continuing to work diligently. We really do appreciate it. Thank you to outside partners. I can't say enough that we wouldn't be able to do this with outside partners, like the Educators Cooperative, they're working really diligently to across sectors, across private schools, public schools, even EOCs, just working with staff to make sure that they are communities built to support educators, making sure that we are sharing best practices. They are just one, but there are so many others that are supporting us, so thank you. We will have a board retreat where I believe we will be able to tackle the work sessions around budget, around literacy/MAP scores, and then even around students with any kind of exceptional needs, as Mrs. Bush requested. So I'll finalize all of that, send that out to the full board. Of course, I'll work with you, Dr. Battle, so that you can send it to your staff. We want to make sure that we are as responsible and efficient with their time, so we won't ask that they all be there with us. But as at your discretion, they are surely welcome to join us for conversation. Again, I want to send prayers, thoughts, hopes, crossing fingers that the Little family has been able to welcome the newest addition to their family. So please send good vibes to the mother and the family. Also, if you had not seen it on BET's Disrupt and Dismantle 2 weeks ago, Nashville was featured. We had a number of Nashvillians who were there. It's just, I appreciate that there's a conversation that is being had around inequities, around the school to prison pipeline. I had hoped that the documentary would be a bit more of a call to action and a reinforcement of all the good work that we're trying to do here in Nashville, but it was at least nice to see a spotlight on what we are trying to do or beginning to do. So just if you have nothing else to do, please feel free to watch that. That's it for us. We'll see you at the board retreat and then see you all again in 2 weeks for the next board meeting. Happy fall break. Happy Social Workers Week. Be there no further business. This meeting is adjourned.
What day is the retreat? When's the retreat?
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.